What do you think is an example of big win so far for you that kind of opened up your career from that point?
In the realm of physiatry. So, for those who don't know me, I'm a board certified physical medicine and rehabilitation specialist. I went and did a 1 year ACGME fellowship in pain management, so board certified in pain, then did a 7 month fellowship in stem cell and regenerative medicine. And despite all of those things, to answer your question, I would tell you getting into the field of endoscopic spine surgery has been my biggest win. If we look at how we take care of spine patients over the last 30 years, there is a lot of slicing people open, not just open, wide open, shredding muscles off the bone, removing bones, placing rods, screws, bone grafts, fusing people, revising those fusions. As an amazing anesthesiologist, I've seen, I'm sure, far more wild cases. But, the reality is, so many other fields of medicine have gone from wide open to what we call percutaneous, or being able to, access things, with a stab incision or a small incision, but spine really hasn't. And not, for those in the know, it would be no surprise that, the Koreans, the Germans, the Indians, they are light years ahead of us when it comes to spine endoscopy. And so my big win was to look at the field in totality and say, what can we do better? And what we can do better is try to accomplish the goals of open surgery without opening the patient. And, many of the listeners will clearly know the example of cardiothoracic surgery and cracking the chest open, and now interventional cardiologists who are able to, place stents, place valves, fix major deformities within the cardiovascular space that require big incisions and ICU stays, and almost sometimes patients go home same day or next day. So for me, seeing where endoscopy could go, seeing how it can help my small group of patients, that's been my biggest professional win.